Hi guys, welcome back to another question in the Inicet MDS series. So in this series we are going to learn about an important topic, that is Waldeyer'S ring, right? So let's just see what is Waldeyer'S ring. I know everybody of you know about that. So let's just see it in a gist. So Waldeyer'S ring is a ring of what? It is a ring of lymphoid tissue which is located in the nasopharynx and the oropharynx, right? So Waldeyer's ring is a ring of lymphoid tissue which is located in the nasopharynx and as well as oropharynx. So it consists of what? Tonsils, which play a crucial role in the immune defense system of the nose and the oral cavity and the upper respiratory tract and alimentary tracts. Okay, so let's just see what are the components of the Waldeyer's ring. And before that, let's just see who is the why is the name Waldeyer's ring has come. So it has been named as Waldeyer's ring after a German anatomist, that is Heinrich Wilhelm Gottfried von Waldeyer'S. So under his on his this thing, it has been named as a Waldeyer's ring. There are four components of Waldeyer's ring. The four components will be PTPL. What is PTPL? The PTPL is nothing but pharyngeal tonsils, which are also known as adenoid, tubal tonsils, palatine tonsils, and lingual tonsils. The reason it has been named as a ring, because the pharyngeal tonsil, which is situated here, the tubal tonsils, which are situated here, the tubal tonsils are present on either side, right? And palatine tonsils which are also present on either side, and lingual tonsil which is present in the lingual side of the tongue. So because of this, it has been named as a Waldeyer's ring. So all these combine and form a ring. So the components of Waldeyer's ring are four. So the four components, you have to remember this, right? Then coming to the each of the component, let's just see what it does in the body. So the palatine tonsil, let's just see about the palatine tonsil. You can see, appreciate the palatine tonsils here in this image. So it is present on the lateral walls of the oropharynx. So it is present between the palatoglossal and palatopharyngeal arches. It is present between the palatoglossal and palatopharyngeal arches. So these consist of what? Lymphoid tissue. So it is easily visible during the oral examination. So they play a significant role in immune defense. Okay, they trap and destroy pathogens which are going into the alimentary tract through nose and mouth. Okay, so this is what a palatine tonsil is. Next, coming to the lingual tonsil. The lingual tonsil, as the name suggests, it is located in the lingual side of the tongue, that is the posterior surface of the tongue near the base of the tongue. So it consists of aggregated lymphoid nodules. So you can see the histological image here. There is aggregation of lymphoid nodules or lymph tissue. So it is covered by stratified squamous epithelium. You can see the epithelium, which is very thick, right? So yes, this is covered by stratified squamous epithelium, and it is less visible when we are seeing through the oral cavity, but it contributes to the immune surveillance in oral cavity. So particularly those pathogens which occur in the tongue. Then coming to the pharyngeal tonsils. Pharyngeal tonsil, which is a very important tonsil, because this is the tonsil which gets commonly affected in children and presents itself as tonsillitis, right? So it is also known as adenoids. So it is situated in the posterior wall of the nasopharynx. So it is situated in the posterior wall of the nasopharynx. You can see here. So the pharyngeal tonsil is situated in the posterior wall of the nasopharynx above the soft palate. So this is important. Above the soft palate, it is pharyngeal tonsil. So what does it consist of? It also consists of lymphoid tissue. So, and it plays a crucial role in defense against those pathogens which are coming towards the nose. So it is particularly active during the childhood and tend to regress with age. So this is very important. So pharyngeal tonsils or the adenoids are particularly active during the childhood and tend to regress through as the age happens. Okay, then tubal tonsil. The tubal tonsil which is a smallest tonsil. So small masses of lymphoid tissue which occurs in the opening of the auditory tubes or the eustachian tubes into the nasopharynx. You can see the tubal tonsil being marked here, right? So it is mostly associated with ear infections. Okay, so it protects the humans from the infections from the middle ear. It stops the spreading of the infections from nasopharynx to the middle ear. So the tubal tonsil helps in that. Then comes to clinical relevance. So as I have told you before, the major important clinical relevance is inflammation of these tonsils, which is also known as tonsillitis, which occurs due to recurrent infections or other factors. The symptoms include sore throat, difficulty in swallowing, and also fever. So apart from tonsillitis, we can also see certain other symptoms. So certain other, like enlargement of adenoids, that is the pharyngeal tonsil. If it gets enlarged, we can have the condition which is called as obstructive sleep apnea, that is OSA. So the OSA condition can appear because there is an enlargement of pharyngeal tonsils. So it is characterized by repetitive episodes of partial or complete upper airway obstruction during the sleep. So this is a very important clinical point you have to remember. And one more extra bouncer point I am giving you. So this might be asked in the exam in the INICT or in future INICT. So this is a grading of tonsils. So there are a total of 5 grades. Okay, here I am showing 4 grades. The 5th grade is 0. It starts from grade 0. Okay, the grade 0 is nothing but surgically removed tonsil. Okay, so there is no tonsils present in the patient. So here what happens, the tonsils is removed surgically. Then grade 1, it is the normal tonsil which is there within the pillars. Grade 2, tonsil less than 50% from midpoint between uvula and the pillar. Then tonsil grade 3, which is more than 50%, which is crossing midpoint between uvula and pillar. And grade 4, which is crossing the midline of the uvula, right? So these are the 5 grades of tonsils. Okay, remember there are 5 grades of tonsils, grade 0 to grade 4. Okay, grade 0 is the one where the tonsil is removed surgically, right? So this is an extra point which you can remember, and it might be asked in the exam also, right? So this is one thing. And coming to the INICT MDS previous year question that was asked was, Waldeyer's ring does not involve. It's a very easy question and very straight question that they have asked, and the options were lingual tonsils, pharyngeal tonsils, submandibular nodes, and palatine tonsils. So the correct answer will be yes, submandibular nodes, right? So I hope you are clear with Waldeyer's ring now, and please remember the points which were told because they are very important. Okay, so if you have not yet practiced our mock test series, kindly go register, practice our mock test series so that you are well prepared for your INICT MDS May exam. Thank you, and please follow us on our social media handles. Thank you.